Good day, listeners, and welcome to a new week. Hope you had a great weekend. Welcome to the DDM Health News Update. The President of Pharmaceutical Society of Nigeria, which is the PSN, Auba Tanko, has issued a pressing call to the federal government urging immediate intervention in addressing critical challenges hampering pharmaceutical practice and public health in the country. Speaking during his inauguration and the investation of new PSN fellows, Tanko decried the prolonged delay in implementing the long-approved consultant cadre for pharmacists, despite successive approvals by the National Council on Establishment in 2011 and 2021, as well as multiple directives from the Federal Ministry of Health and the Office of the Head of Service of the Federation. Despite the final establishment approval in late 2024, he accused chief executive officers of the Federal Health Institution of deliberately obstructing the process, thereby denying the health sector the benefits of this crucial initiative. Tanko urged the Federal Ministry of Health to enforce its directives and hold non-compliant institutions accountable, warning against insubordination within the public service. He also expressed deep concern over the reluctance of state governments to adopt the consultant cadre, with Lagos State's suspension of its approval circular being particularly troubling. Beyond workforce reforms, the PSN president also sounded the alarm on Nigeria's escalating counterfeit drugs crisis, stressing that absence of a lawfully constituted Pharmacy Council of Nigeria, which is the PCN, has severely hampered regularly oversight. While NAFDAC has a fully constituted board, the PCN remains without a governing council, leaving critical regulatory functions, including accreditation of training facilities and enforcement actions, largely ineffective. Tanko underscored the need for urgent collaboration between NAFDAC and the PCN to curb the circulation of substandard and fake drugs, which he described as a trillion-naira menace threatening public health. He called on the Honorable Minister of Health to immediately inaugurate the PCN Governing Council, emphasizing that a robust and coordinated regulatory framework is essential in the fight against counterfeit pharmaceuticals and the broader efforts to safeguard Nigerians' well-being. With public health at stake, the pharmaceutical sector watches closely, awaiting decisive government action to uphold professionalism, enforce regulations, and ensure safe and effective healthcare for all Nigerians. Next, in a concerted effort to extend quality healthcare services to the grassroots, the Lagos State-owned General Hospital, Mushim, in collaboration with the Odeolowo Ojuwoye Local Council Development Area, has taken its free medical outreach to the bustling Ojuwoye market. This impactful initiative provided hundreds of traders, shoppers, and residents with a wide range of essential healthcare services, spanning obstetrics and gynecology, pediatrics, family planning, immunization, general surgery, ophthalmology, dental care, and physiotherapy. In addition to comprehensive consultations, beneficiaries receive free medications, eyeglasses, and pharmaceutical services. The hospital set its target of reaching out at least 1,000 individuals through this outreach. Beyond medical interventions, the program featured health education section addressing prevalent conditions such as hypertension, diabetes, and eye disorders, reinforcing the importance of preventive health care. Speaking to the significance of this initiative, the Medical Director and Chief Executive Officer of General Hospital, Mushim, Dr. Oluyemi Taiwo, emphasized that the outreach aligns with the hospital's mission to take healthcare directly to the people rather than waiting for them to visit the facility. We recognize the need to meet people where they are, especially in a busy commercial hub like Ojuwoye Market. This initiative ensures that more individuals have access to quality medical services at no cost, Dr. Taiwo stated. She further highlighted that the outreach was strategically timed to ensure residents are in good health ahead of the upcoming Ramadan fast, offering free health checks, consultations, and medications. Echoing this commitment to public well-being, the chairman of Odeoluwo Ojuwoye Local Council Development Area, Honorable Rasak Ajala, reaffirmed the council's dedication to improving healthcare assets within the community. Our administration has prioritized healthcare by establishing primary health centers, recruiting additional medical personnel, and facilitating free medical services for our people, Ajala noted. He urged residents to seize the opportunity provided by this outreach, emphasizing the importance of routine health checks, particularly for conditions such as hypertension. As a community, we must prioritize our health, regular blood checkup, and hospital visits for preventive care can save our lives, she advised. This strategic health initiative underscores the Lagos State government's ongoing commitment to ensuring that quality health care is both accessible and affordable for all, particularly for those in undeserved communities. Finally, in a concerning development, the Nigeria Center for Disease Control, which is the NCDC, is currently monitoring over 461 individuals for potential Lassa fever infection as the viral disease continues to spread across the country. According to data obtained by Sunday Punch, Lassa fever has now been confirmed in 63 local government areas across 11 states, raising significant public health concerns. The acute viral illness, primarily transmitted by the common African rat, Mastomys species, thrives during Nigeria's dry season and possesses a recurrent challenge to health authorities. Since the major outbreak in 2016, Nigeria has witnessed a steady increase in Lassa fever cases. Worryingly, fatalities recorded in the first 6 weeks of 2025 have already surpassed those of the same period in 2024. While 48 deaths were reported last year, the current death toll has risen sharply to 80, with 1,913 suspected cases documented by the NCDC. Adding to the crisis, 11 healthcare workers have been infected this year, underscoring the urgent need for heightened surveillance, preventive measures, and strengthened response efforts. Authorities continue to urge the public to maintain strict hygiene practices, avoid rodent exposure, and seek immediate medical attention if symptoms arises. Well, friends and viewers, this is all we have for you for now. Stay tuned for further updates as we continue to track this developing story. Don't forget to like, share, subscribe to our YouTube channel, Diaspora Digital Media. I remain your host, Nenyer Michaelin is in me. Bye for now.